Mr. Chair.
This is the former Surgeon General of the state of Rhode Island.
Or something. Mr. Chair and members of the committee, thank you for the opportunity to testify before you. Again, it's a great honor to be back.
My pleasure.
And thank you for your fortitude in listening to all the testimony. I'm here to share some thoughts about 5413, about paid sick leave legislation that would bring paid sick leave to the Rhode Islanders who don't now have it. I've reviewed the medical and public health literature on sick leave and health and thought it might help your deliberations if I shared that data with you. There are three main areas of concern vis-a-vis sick leave and health. First, the spread of infectious disease. Second, missed opportunities for prevention. And third, unnecessary or inappropriate but expensive use of healthcare facilities like emergency departments and hospitals. First, people who don't have sick leave and contract an infectious disease often face no choice but to go to work sick and to spread infectious diseases at their workplaces to coworkers and to the public. Norovirus, which you've heard about already, Campylobacter, enterotoxic producing E. coli, rotavirus, hepatitis A, Salmonella, Shigella, and many other organisms can be transmitted by infected food handlers. We've seen outbreaks of food handler-associated rotavirus in Rhode Island recently, and all of these diseases in Rhode Island way too frequently over the years, resulting in too many illnesses and way too many preventable deaths. Other workers can transmit disease by coughing and sneezing if they work sick. After the H1N1 flu pandemic, CDC estimated that infected workers who did not stay home caused 7 million extra cases of flu and 1,500 deaths. Adjusted for Rhode Island, that's 23,000 illnesses and 5 deaths caused by workers who worked sick. CDC estimates that there are 5 million cases of influenza-like illness yearly resulting from no sick leave, and that universal sick leave laws like the one you are now considering will reduce workplace infections in the setting of influenza epidemics by about 6%. Now, and in addition, people who have no sick leave can't get to the doctor for regular preventive visits. So it's hard for many low-income working people to get mammograms, colonoscopies, pap smears, prenatal visits, and well child care because those are not scheduled after normal working hours. And it's harder still to sit down with your doctor to think about and plan for how to maintain your health when you don't have time to go to your doctor during the hours doctors are seeing patients. Finally, when you don't have sick leave, you use the emergency room and hospital more because when you get sick and when you work sick, you have no option but to go after hours. In Rhode Island, between 40 and 60% of emergency department visits are thought preventable, a situation that increased our healthcare costs and put Rhode Islanders at risk for unnecessary testing and intervention at the same time as it reduces opportunities for teachable moments for prevention, the moments that happen when you see your family doctor instead of going to the emergency department. When you have a cold, your doctor will remind you to have your pap smear or to get your kids to have shots or to get your cholesterol checked. And that doesn't happen when you try to go to the emergency room at 2:30 in the morning because that's the only time you can actually get care. Universal sick leave is likely to improve the public's health and to protect all Rhode Islanders, not just low-income workers, not just the low-income workers who lack that sick leave now. And it's simple human decency. No one should have to work when they're sick. Thank you.